I'm Christine Buckley with the Brain Aneurysm Foundation, and I'm excited to invite all of you to this webinar concluding Stroke Month. And our webinar title is Not So Fast, There Is Another Stroke. A lot of people don't know brain aneurysms are a subset of stroke, and that's what we're going to focus on today. And I'm very excited to have with us Dr. David Stoffel, who is the Chief Business Officer with RapidAI, an amazing company that is doing a lot with subarachnoid hemorrhage, stroke, and brain aneurysms for better detection, treatment, and outcomes for patients. So it's my pleasure, David, to welcome you and hand it off to you and just ask everybody to stay muted and we'll address questions at the end of the presentation.
Great. Thank you, Christine. And thank you to the Brain Aneurysm Foundation for having us on and sponsoring this. It's really it's such an important thing for us to have forums to gather, to educate, to share stories. And so we really appreciate the opportunity here to present and talk to you all. I was asked to put together some slides, and we'll have maybe like a 10, 15-minute talk prepared. But really look forward to the conversation afterwards and hearing your thoughts and hearing your reactions and really, sharing some stories and questions. So we're really talking today, as Christine said, it is Stroke Awareness Month. And it's really important because I think all of us here and myself personally have been touched by, stroke in one way or the other. And Christine said it, there's different types of stroke. The one that we think about the most is the one called ischemic stroke. And that's where there's a blood clot in the brain and it cuts off the blood supply to it. And the brain then has some sort of reaction, sometimes can die, unless that clot is removed. That's the one that we think about. It's about 85% of the time. If someone says they have had a stroke, it's usually the one that they're talking about. I personally have had an aunt that passed away this way. The good news is that with all the technology, with AI, physicians, all the catheters, all the advancements, there are still bad outcomes here, but there are more good outcomes than bad. People can walk out of this, can resume their normal life. They say they're walking out of the hospital as opposed to being wheeled out of the hospital. But there is a different type of stroke out there, and it's called a hemorrhagic stroke. And that's where there's actually the blood starts getting into the brain. So instead of a thrombus that cuts off blood supply, there's almost too much blood. A vessel bursts and blood gets into the brain. Fortunately, this doesn't happen as much. It's about 15% of the strokes out there. But the bad part is that there's really bad outcomes associated with this. 50 to 60% of the people can have severe consequences, maybe even death from this type of hemorrhagic stroke. And and this is one of the hardest things out there. Personally, I've been affected by this. A very good friend of mine had a hemorrhagic stroke. He actually had a burst aneurysm, and he was fortunate in that it happened 200 feet from UCSF, so downtown San Francisco, and they were able to treat his hemorrhagic stroke by evacuating the blood. They said if he had that same thing happen maybe even a half a mile away, he could have died. He likely would have died. So it just shows you how hard this is to treat and how important it is to find these things, not only in a timely manner when they happen, but also to prevent them from happening. And this kind of ties into the Brain Aneurysm Foundation, is that the most common cause of a hemorrhagic stroke is a ruptured aneurysm. Now, I think we've all seen these statistics, but it's worth revisiting. About 2% of the U.S. population is estimated to have an aneurysm. Now, the scary part of it is that probably only 50% of those people have been diagnosed. There is a good 3.4 million people estimated to be walking around with an aneurysm in their head and not knowing it. 1% risk of rupture in these aneurysms per year. So let me explain what that means. That means every year there's a 1% risk of that rupturing. And that goes back to that 60% bad outcomes in following rupture. So it's incredibly important that when we that we find these aneurysms and we're able to treat them so that we can prevent this tragic outcome of a hemorrhagic stroke. Now, Again, Rapid, we're a California-based company. We spun out of Stanford University. We're in over 2,500 hospitals, and we're AI, artificial intelligence. We have software that lives on the scanners of hospitals, so CTs and MRs, and it scans every single image it goes through, and it finds things like aneurysms or strokes or hemorrhagic strokes. We're in about 2,500 hospitals. But one of the proudest things that we do is partner with organizations like the BAF, the Brain Aneurysm Foundation. And so we can bring this message of awareness to patients. It's incredibly important to us that our mission is, and part of this, a big part of our mission is educating the patient population about what options are available, and most importantly, the importance of finding these aneurysms and getting them treated. So we'll go through this one by one here on solving the brain aneurysm challenges. So really, remember, we're trying to prevent hemorrhagic stroke and preventing these aneurysms from bursting. So the key is to go all the way back and try to find them before they burst. Unfortunately, it's really hard. There's a reason why people are undiagnosed with aneurysms. One, they have to get a scan. And two, even when they have a scan, it's really hard to read. Even for trained radiologists, over 15% of aneurysms are actually missed. And the job of a radiologist is getting harder and harder every day. There's almost a 600% increase in the number of images they're doing. And so they have to get faster and faster at reading these. And so the likelihood of missing it and the pressure of missing these things gets more and more. On the right-hand side, I'm going to replay that little video. Again, I'm not a trained radiologist. I don't know if many of you are, but there are two aneurysms hidden on the image of that skull right there. Now, that's almost impossible for you and me to look at that and say, hey, there are two aneurysms. Neuroradiologists who are trained, these actually were missed on a scan. So even the trained neuroradiologist missed it on this scan. The good news is that, and this is where someone like Rapid comes in, is there is technology that can help you find these aneurysms. And it's kind of cool. It's a cool image right there. Instead of looking on it on a 2D plane, the AI takes the image, reconstructs it from a 3D way, and searches all the vessels looking for these little sacs, these aneurysms. And then when it finds it, it highlights it for the radiologist, and it also gives the volume estimate and the morphology of it, so the shape of it as well. So it's not just finding you the aneurysm; it's giving the physician more information about the aneurysm than they would otherwise have. This is that scan. This 3D reconstruction is the scan from the previous slide that when they reran it using AI, made finding the aneurysms very, very obvious. We took this study at an academic center called Stony Brook Medicine. Great institution, nation leading for neurosurgical care. And we ran our AI with a neuroradiologist read over 12,000 consecutive scans. And we compared it to just a neuroradiologist reading by themselves. And what we found was actually pretty shocking. The neurorads with AI compared to neurorads without AI found 23% more aneurysm using the Rapid solution than without. And these weren't just tiny little flecks. You can say, oh, okay, maybe they're just a little tiny infundibulum, 1 millimeter. These were actually almost 4 millimeter aneurysms. Many of these considered treatable almost upon diagnosis. So it just shows you the benefit of using technology to bridge these challenges that we have in healthcare to deliver better care for you, me, and all of our relatives. So now we've gotten to the finding it. So that's one of the challenges, but now we have to assess it. We have to say, is this aneurysm at risk for rupture? Again, bear in mind, we're trying to prevent hemorrhagic strokes here. The two things that are the most important in assessing the risk of an aneurysm are its size and its shape. I'll explain what I mean by that. The size is just what we saw as like, hey, it's a 4 millimeter aneurysm. It's measured at its widest part. But the shape is really interesting because all of these things, all these aneurysms have different shapes, and the different shapes mean different risk profiles. Just a point to raise that's really, really hard to measure these things. So on the right-hand side, that little scatter plot there is where we asked, I think it was over like 40 or 50 radiologists to measure a single aneurysm. And you'd think measurement would be pretty straightforward. But no, if you look at that, look how much scatter there was in terms of them measuring. This is by manual means. So an aneurysm, they had some were saying it was 3 millimeters bigger than it was. Some were saying it was almost 3 millimeters smaller than what it was. So that's almost a delta of 6 millimeters in the assessment of an aneurysm. And that's the number one risk profile of determining whether an aneurysm is going to burst or not. So you can see how much variance there is, and even in the trained experts, and how hard this is to do. So this is the same thing as the image. You can take two radiologists, just one single slice before, and they're almost off by an entire 1.5 millimeters in terms of how they're assessing this. So it's really hard to do on a manual basis, and there's a degree of what they call inter-reader variability. So again, this is we're an AI company, so naturally we have a solution for that. One of the biggest uses of this is that our technology automatically measures the volume of these aneurysms. And we've been shown to be 99% accurate according to the best neurorads type of measurement. That was all in our FDA documents. So the AI can all of a sudden take what the manual work away from the radiologist, and the radiologist can then use their judgment on saying, oh, this is a risky aneurysm, and be able to communicate that, as opposed to spending all their time trying to measure things or determine what the morphology is. The AI can take that grunt work away and let the doctor practice at the top of their license, using their judgment, using their training for the betterment of care, as opposed to struggling with the measurements. I love this picture. My wife's a big fan of the royal family, so we threw this in. Perspective means everything, right? You might know that's Prince William on the left-hand side. What he's doing, and from this perspective, what might be considered an international incident. You look at him, he's kind of snarling, he's flipping the bird to people. It might be angry at some paparazzi that crossed the line, but this would be an international headline discussed for days. But you look on the right-hand side, it gives you the full perspective of what's going on. The guy might be just ordering 3 sugar cubes for his tea. Not that big of a deal. Just gives you shows you the importance that perspective has on these images, that something looked from one angle could be benign or could be completely malignant. But when you get that full picture, it could be the exact opposite. And again, that's what our technology does, and that's what AI can do for your aneurysms. It's another just cool video. We are an AI company. We like cool videos and showing off the tech. But again, just standardizes the measurements, gives our radiologist the morphology. So you take away all that grunt work, take away all that time that the radiologist has, gives them one set of standard truth, and enables them to be able to discuss this with the patient that much easier. So now we found the aneurysm, we've assessed it. Now we get into the management of it. This is a shocking statistic. And I think you're on this aneurysm webinar, so you're probably on the 50% that actually go to your clinic visits. But it says 50% of the patients never attend their follow-up clinic visit. So even when an aneurysm is diagnosed, we can do all the measurements, we can do all those assessments. People walk out the door of the emergency room, they don't attend the follow-up clinic, maybe it's never even booked for them, but the follow-up never happens, and these people are lost to follow-up. That's a tragic thing, because these people know they have aneurysms, or they're told they have aneurysms, but they don't take that. They're not unable for whatever reason to take that next step. And that's something that actually AI can help with as well, because once the AI detects something, it automatically communicates that to the physicians, to the nurses, as well as to the administration, that there's a patient here that needs follow-up. So we have technology that can actually track your aneurysm and make sure that you've gotten your follow-up visit. It makes it that much easier for the hospital to ensure and book that patient has a follow-up appointment in their clinic. In fact, we use this technology at University of Pennsylvania, one of the best neurosurgery programs in the world. And they found that using this technology and this tracking mechanism, they got 5 times more follow-up than they did otherwise. In other words, these patients were seeing the physicians after the diagnosis and getting that potentially life-saving care. And this is another thing, just I don't know if there are any physicians in the room as well, but as a patient education or patient interaction tool, this is also priceless. So many times I think we've all been there where a doctor's like trying to describe your aneurysm. He's either sketched something out on a sheet of paper and it looks like, something a second grader might draw. They can actually bring these images into the room with the patient and you can have a very educated conversation about this is where your aneurysm is. This is what it looks like. And it facilitates that much more of a conversation and education. And I think the severity of the situation that patients do follow up. So it's a wonderful patient education tool. And also for the physicians, many of these physicians have to measure these things manually. So before clinic, they're preparing for your visit. They're out there measuring these things with like a little manual caliper and a ruler, trying to prepare for the conversation, trying to assess these. AI can take that all away from them and give them time back to do other things. Again, University of Pennsylvania said that this technology saved them almost 3 hours of clinic time per week by just saving them that time from manual measuring. And that's time that they can use to spend with more patients, see more patients, or do other things as well. So treatment. This is actually another shocking statistic. We've got a lot of shocking statistics here for you today. Over 40% of aneurysms that are growing are missed. So you can find them, you can assess them, and you've done the right thing by following up in clinic. And 40% of the time, your aneurysm is growing, and the technology that we have today is not sensitive enough to detect it. Well, again, wonderful AI that can detect those changes. In fact, we have a study coming out of Stanford University that showed how the AI detected for that 40% of growth that happens. It detected growth 40% of the time that when it was missed by a neuroradiologist. And this is, again, coming out of Stanford, one of the best neurorad places in the country. And they found that the AI detected more growth. And all this translates into better treatment for your patients. The little study right there. So now we're talking about it. Finding, assessing, managing, and treating. So what can you do about this? We will always we have always great relationships with physicians. If you're interested in having this technology as a part of your treatment paradigm, you can call us. We can always refer you to a physician in your area that is using this, because it really is a wonderful tool to assess the risk of your aneurysm and to get, again, whether it's for yourself or for your relative, and to deliver that life-saving care that we all need. So I want to thank Christine again for the opportunity to discuss this and present this technology, and look forward to a conversation. So thank you for your time and attention. I'm going to stop sharing now.
Excellent presentation, David. Really appreciate that. It was very clear. I think it hit some of the questions that had already come in, but I'll ask a couple that I saw.
And I just want to be clear,
I,
Prince William was
Go ahead.
not flipping the bird. We just want to be clear. If there's any questions on that, he was not flipping the bird to anybody.
Oh gosh, I don't. I mean, that was good though. I mean, it is nice to show something that simple about perspective, because it
Mhm.
definitely impacts all of us in many different ways. But, I know the value of AI for aneurysms and all the aspects you mentioned, finding them, assessing them, managing and treating them. And I think there's always frustration in everything. How is it going to become more prevalent? How is it going to be? You said in 25 centers, I don't know how many centers there are just in the US alone, but how is that, what's holding back, anyone who's going for a scan, making sure that AI is looking at it. So like you said, it's missed like 15% of the time. Like, how can we get more people to use it? Or if people are on here, how can they advocate for their facility? Like, why are you not using this?
Well, you know what? A big part of this is just awareness. Sometimes physicians are busy in their practice and their lives, and they're not always aware of that technology. And so even you asking about the AI solution and saying, hey, there's technology out there that says there's a 3D rendering of my aneurysm. Have you heard of that? You could even play a role in educating your physicians and building up that awareness. And so I think patient advocacy and patient awareness is one way you could drive physicians to help adopt that technology. So again, I think we all could play a role. But again, this is new technology. It just came out. So you also have to give it time to proliferate. There's just what they call a technology adoption curve, where sometimes it takes time. But again, how do you accelerate that, which is your question? Patient advocacy and patients asking about it could play a big role.
And I thought it was fascinating, the study you mentioned at Stony Brook. And what you're saying again, same with us, patient advocacy, people finding something out, share the information, you've learned this, share it. There's little, snippets will highlight, going forward. But just the fact that there was 23% more aneurysms found at that study from Stony Brook, with the size of them being almost 4 millimeters, I mean, that's crazy.
Oh,
Because, organizationally, we tell people, I mean, the frustrating parts are, it's a very treatable disease, right? But you can't treat it if you don't know that you have it. So this
100%.
is just seems so much missed opportunity here to prevent the ruptures, which is what we really want. We want to have there be a world without ruptures because again, the treatments are so good. So I mean, for people here, I mean, we can look up the study, maybe we'll find it later and share that link, but I think there's just that alone is so important for people to know.
Oh, at 100%. And this isn't an indictment of the radiologists, saying
No.
the radiologists are phenomenal, but think about it. They have to click through these 2D images, and what they're doing mentally is creating a 3D image of what they're seeing. And really, what AI does, it takes all those images, stacks them on top of each other, and creates the 3D image for the doctor that they're trying to create mentally, and just puts it in front of them. It's really as simple as that, and that's how they can see these aneurysms that much better. Because you're there. These guys have to look at these women, guys all have to look at these images within 30 or 45 seconds and make an assessment. Sometimes they'll spend a minute and a half. Errors are going to happen. And so if AI can create those 3D images, it's like a paradigm shift in how they can look at the anatomy and make it that much easier for them to see it.
And I think it is important for people to understand exactly, you can't get rid of the human beings in this process.
Oh, you don't want to. You
This
don't
is
want
just an
to. Yeah.
additional tool to help them. We're not trying to replace them. The AI in this instance is very much just a tool. A question that came in, it says, does the Rapid software give any additional value on coiled aneurysms on follow-up for aneurysms that have been treated?
So we're working on that. Right now, if it's coiled, it's usually followed by MR, and there's a lot of scatter, and so we don't have that software just yet. We are working on that, so that's a great question. Hang on, in about 6 to 9 months, we think we will have technology that can help in that assessment of the post-op management.
Excellent. Here's another one. How does the clinical presentation no, that's not the right one. How can patients with an aneurysm see 3D views of it during the growth monitoring checkup? So, are patients allowed to see this imaging when they go back?
Yeah, and typically, what the University of Pennsylvania, they have it on iPads, and they'll go in there with the patient and say, "Hey, this is your aneurysm," and they'll be able to show. You saw that little like the image, and then there was a little bit of shadow that showed the growth. They'll share that image, and that's the basis of the conversation that they have with the patient. And what they've said is like, all the other benefits aside, they love that patient education aspect because it's facilitated much better conversations with their patients in terms of determining those next steps. So certainly it's up to the physician, but the ones that are using it as a patient education tool, you just see it in your regular clinic visit.
Great. And is it possible for AI to be used when someone is clipping an aneurysm? Is there a role for it there?
Yeah, so intraoperative. Again, I'm promising things that are making our engineers, I'm sure, heads explode, but that's also coming. So intraoperative type of assessments. We have technology right now that can do like 3D reconstructions of the aneurysms of the entire cerebral vasculature from the aortic arch all the way to the cerebral vessel. We're working on making that available on an intraoperative basis, which is kind of what you're describing.
Great. Then someone asked, what's the role of CTP in diagnosis?
Oh, so CT, that is an expert level question. So kudos to whoever put that out there. So CTP is primarily for stroke, for ischemic stroke. So what it is, it measures a mismatch, and it will say, okay, compare the blood flow of one side to the blood flow in another, and be able to assess exactly where there might be a blockage. So where there's an aneurysm, so what we do with a stroke patient, they usually look for hemorrhage, they look for aneurysms, and they look for stroke. So the CTP is a part of that side of the stroke assessment. But great question.
Excellent. Should all stroke alert patients get perfusion imaging, or should facilities be more selective in who gets advanced imaging?
So the guidelines just came out in February. So this was a controversial subject, or one that was kind of up in the air. I think the guidelines really came down. If a site is going to do extended window thrombolysis, so up to 24 hours, um, you need perfusion in order to make that assessment. So where perfusion was only really used in the hubs, the places that are doing mechanical thrombectomies, we're already seeing perfusion being used as a frontline therapy in a lot of these spoke facilities as well as critical access. So yes, the answer is perfusion is moving out to more to be a frontline therapy or diagnostic in more and more hospitals, and that's really driven by the new guidelines.
Excellent. Um, I think the last question I'm really seeing is how would someone word their report if their opinion differs from the AI interpretation?
Say that question again.
Someone's asking how to word a report, their report, probably a radiologist, if their opinion differs from what they see from the AI interpretation.
Oh, yeah, great question. I want to emphasize that the AI is a tool, and the physician's judgment is always what you rely upon. And so the physician might have a look at the AI, and as much as we like to brag about it, it's not infallible. It's technology. And the physician might look at it and say, no, I see something different than what the AI is seeing, and commit something different to the PACS. So the AI appears as a recommendation in what they call the PACS and a viewer. And the physician can agree with it or disagree with it or adjust it even and say, you know what, I think this is where the aneurysm actually is. And then they can commit it to PACS. But it all relies upon it's all a suggestive thing for the adjunct, rather, for the physician to use. The physician always has the final opinion and can and do make adjustments to it, and they should. So I want
Okay.
to emphasize, Christine said that really well. This is a tool that helps the physician. In no way does it replace the physician. I got too many relatives who are physicians, so I have to say that in order to have a okay time at the family dinner table.
And like that. And then I had another question because again, for foundationally, for us, the early detection and people finding out they have it and preventing ruptures is so key, which is why we love this. So just for clarification, if someone is using the Rapid product, does it do all those things? Does someone use them just to find them, or do they use it for the find, assess, manage, treat? Is it like a whole package, or do people use it for kind of different parts of it, or is one more important to the other in certain circumstances?
We all sell it separately, but most people buy it as a complete solution.
Okay.
Sometimes you can just buy like, hey, we just want to triage and find it. But most people buy it as that package of saying, hey, we want to find it, we want to assess it, we want to manage it, track it over time. That's where we've seen the greatest uptake in the marketplace. Like University of Chicago is doing an amazing job of setting up this network, and where they just go and they use it and assess it. Stony Brook also is using it. Phenomenal. They're doing a phenomenal job of implementing it. But they use that entire solution, and most
Okay.
people typically do.
All right. No, I think that it's amazing. And again, it's stroke month. It's, the ischemic stroke, as important as hemorrhagic stroke. However, the hemorrhagic seems to get lost a lot of the time in this. And I
Yeah.
don't think some people know that, when someone has an aneurysm rupture, they're being watched for a vasospasm for 2 weeks that can cause that ischemic stroke. So aneurysms are responsible for 2 to 5% of all new strokes. So, this month is important to us ahead of our aneurysm month in September. But I really think this is great information. I think it provides a lot of hope for people, patients, their families, practitioners going forward. Everyone likes to have a tool, right, to help them through the day, whatever they're doing. There's a lot of pressure everywhere for different people. So I just want to say, from the foundation's perspective, just thank you so much for taking the time to share and let people know what is available to, better treat and get people back to their normal course of life.
No, thank you for the great work that the BAF does, Christine. Raising the awareness and the advocacy in the community, I think, are so essential and important. And like you said it well. We're in stroke month, but you define aneurysms and you treat aneurysms, you're going to cut out a significant percentage of those strokes. So thank you for the opportunity, and really enjoyed the conversation here.
Yeah, no, wonderful presentation. This has been recorded. We'll get it out probably in the next week or so for people to share and just get the word out in all aspects. So, everyone, I hope you have a great weekend. Thanks so much again, David.
Thanks so
And
much. Take
thanks to
care.
Rapid.